So, the lymph system, the lymphatic system, is a low pressure system. So you can imagine, again, just like the venous system, it's so far away from the heart. The lymphatic system doesn't have cardiovascular kind of support. So there's no pumping of the heart. So there has to be other mechanisms that transports lymph because again it's going if it's going from the feet and the legs to the heart, it's going a long distance and it's going against gravity. So it's going all the way up to the heart, where we said the subclavian and the internal jugulates are meeting. That's a long distance that it's coming from the ankles of the feet. And there's no pump pressure. So there has to be other ways that we can get the lymphatic lymph fluid to where it needs to go and back into venous circulation. So it is a very low pressure. I would say it's even lower than the venous system. So we do use the same mechanisms that venous system kind of uses to help move it. So the first one is moving the skeletal muscles. So remember with the veins, so we had the vessel in kind of running along a skeletal muscle, and then we'd have the squeezing of the skeletal muscle that would help kind of move fluid, sort of like squishing a tube of toothpaste, so that you squish there and then you squish there, and it helps move the fluid upwards. So that's again why circulation, when we say get up, get moving, it helps with circulation. It really does. So it does help with the veins moving, but also your lymph transport as well. We'll talk more about pressure changes during breathing, but that's how breathing occurs is actually changing the shape of your thorax and changing the pressures that are within your chest. So when you breathe in, you are actually at a low pressure compared to the outside world. When you breathe out, then you are at a higher pressure than the outside world. And that's how air is moving from high pressure to low pressure. And we'll get into much more detail when we get to the respiratory system. But that's another thing that helps milk or move lymph along that's in the thorax. Remember, the thoracic duct is mainly in the thorax, with that possibly 50% of the individual have the cisterna chyli. So you have a time where pressure is increasing when you're breathing out. So you can have kind of squish on the vessels and move up fluid upward as well. Just like with veins as well, the lymph vessels have valves, mini valves. In fact, they have more mini valves in the lymphatic system than in veins. So remember we had the veins, kind of internal part of the venous system had valves. Well, there's even more valves in the lymph system. So that helps with backflow. You open up a valve, you go here, and you can't go backwards because you hit the valve. So you can't flow backwards. So it's like climbing a little ladder. So step to step, you can't go backwards. You can only go forwards. So that helps because as the skeletal muscle is squishing, you get along, you go up a step, and you can't go backwards as the muscle is relaxing. Same with the changing in pressures. It squishes, moves fluid up. Well, if it can't go backwards because there's a valve, and then the next time you breathe, it pushes a little higher. So it's just kind of this slow milking experience going from the lymph back to the venous circulation. Another thing is just like veins, lymphatic vessels run along arteries. So they are higher pressure, and they, just like when you feel your pulse, they kind of expand and then contract. So blood goes in, there's higher pressure, and it stretches some, not all the arteries, but some. And then blood goes past and they rebound. So there's very much elasticity to it. Well, that squishing, kind of pushing out, can squish into a vein or a lymphatic vessel and help move the lymph along as well. There is smooth muscle both in the veins and in the lymphatic vessel walls. So that is some movement, but we don't depend mostly on this. This isn't strong enough to move lymph. It has to depend on all these other components as well. So another thing, again, physical activity increases your flow of lymph, increases your flow of your venous blood as well. So that's again another reason why physical activity is going to be useful in the increasing of circulation. When we say that we kind of rest the rice thing when you have inflammation somewhere, the rest ice compression elevation, that is true. So you want to immobilize in the inflamed area. So you want to stop moving. Say your knee is swollen for whatever reason or inflamed. And we'll talk about inflammation in the next section. What you want to do is actually for some time to stand still and immobilize. So don't move that joint as much as possible, because that will not increase your circulation in that area. So what you want to do is keep the white blood cells, keep everything in your knee if it's swollen. So if you have a lot of swelling in your knee, you want to keep not moving, because then the circulation won't be very well with the lymphatic system. So all those white blood cells can stay in the area and do their job for longer. If you started to move, then they're going to circulate and they're going to move. So that's going to be one component where you do want to stay still. Otherwise, it does help with your circulation of lymph and venous circulation as well. So if you have an obstruction of your movement of lymph, so for whatever reason, any reason, so edema isn't saying a specific reason why they're swelling. So one of the reasons why you can have edema is because of lessened lymph flow. So if they're blocked, if they're not flowing for one reason or another, then you can have edema, which is swelling. So again, remember when we talked about the lymphatic capillaries, those bind capillaries that had valves on the outside, and then they had collagen fibers that would hold to the valves as well. Well, the more interstitial fluid, remember those cells, the more fluid in between would pull more on those valves and open them as much as possible so that more fluid can move into the capillary. Well, there comes a point where there's only so much fluid, and so wide those valves can open to allow certain amount of fluid to go in. So if you still have more and more and more where the capillaries can't keep up, then you're going to get swelling in the interstitial space. So oftentimes it's going to be for, again, edema is multiple reasons. One is an infected lymph node. So having a lymph node infected where there's decreased flow, because we're going to talk about lymph nodes coming up, that there is in the lymphatic system a chain of lymph nodes. So we kind of just see the ones that are like under your chin, your submandibular, but there's tons of lymph nodes throughout your body, and usually they're in chains. So say you have an obstruction in this one or an infection in this one. Well, that's going to decrease flow because all the white blood cells are going to be slowing down. They're going to be fighting the infection. So there's just not going to have the proper amount of circulation going because it's going to go, again, lymphatic vessels or lymphatic flow is one direction. So it has to go this way. So if you've kind of slowed down or blocked a lymph node, there's going to get buildup backwards. So there's going to be block flow. So think of traffic. If all of a sudden 75 goes down to one lane, there's going to be significant backup of traffic. So think of the same way. If this is down to one lane of lymph flow, well, there's going to be a major backup behind it. So that's going to cause swelling. Maybe not this severe, but it'll cause some swelling. If for whatever reason a lymphatic vessel is blocked, so there's some sort of blockage in it, same thing. So if the road is completely blocked and you have to go in a different direction, well, it'll back up past that block or before that block, so that flow can't go, because again, flow is one direction. So it's going to have a backup of flow, and so interstitial fluid's going to build up. Something that has nothing to do with the lymphatic system, but is increased capillary pressure, which can occur because of hypertension, which is also known as high blood pressure. So again, if you have your capillaries and increased hydrostatic pressure, so you're going to have more fluid moving out of the capillaries, but you have the same amount of blood colloid osmotic pressure because you haven't changed the protein's amount. Well, instead of losing 15% of the fluid to the interstitial space, then you may be losing 25%. Well, that's putting more pressure, and there's only so much the lymphatic system can drain and the valves can open that you'll have backup and you can have swelling that way as well. So, lymphoid tissue. So there's going to be multiple areas where there's actually lymphoid tissue. And this is going to be areas where lymphocytes are. And those are going to be our major theme for the immune system next. So why do we want lymphoid tissue in a place for lymphocytes? Well, lymphocytes, again, are going to be part of your specific immunity, meaning there's a lymphocyte match for every kind of condition that you can. And also macrophages. Remember, macrophages are originally monocytes when they're in the blood, and then they change to macrophages when they're in the tissues. So place, if they're in lymphoid tissue, then they'd be macrophages. And they're the ones that are going to be eating. So again, they're phagocytic, so they consume materials, and I call them kind of the Pac-Man. So being able to have a place where lymphocytes and macrophages can look at that fluid that's being drained from the capillaries is a good way to catch infection. So again, if they're circulating a small amount in your cardiovascular system, in your blood, they may not run into the viruses, the bacteria, the toxins that they are meant to fight against. So this may be a way that they can have more likelihood that they're going to run into that specific virus and be able to fight against them. So most of the lymphoid tissue is reticular connective tissue. Remember, reticular fibers are kind of short and branched, and they're specific for lymphoid tissue because that allows lymphocytes, especially, to attach to, and they can just hang out there like a tree and watch everything go by. So macrophages can be there too. Macrophages aren't specific, so they can consume anything that they find that's abnormal. So if there's a bacteria that's going by, a macrophage can eat it when it's going sitting in the lymphoid tissue on the reticular fibers. So we have diffuse lymphoid tissue. That's going to be just lymphoid cells and some reticular fibers, but it's kind of loosely arranged. It's not specifically in a lymph node that we see. We'll see this area in every body organ almost, because we just want some sort of protection for all of our tissues and all of our organs. So in mucous membranes, so areas that are kind of pink and moist, so mainly oral cavity um, is going to be a major one, then you're going to have a larger amount of lymphoid tissue because this is where things are going to enter your body, is oral cavity, nose, places like that. So underneath kind of the epithelial layer in the loose connective tissue, there's going to be some diffuse lymphoid tissue, meaning it's just spread out. So there'll be reticular fibers, and then those lymphocytes and macrophages hanging out, just kind of randomly arranged underneath, so they can still be monitoring what's going on in the body. So there's also lymphoid follicles. those are going to be more not kind of loosely arranged, and they're just kind of more in bubbles that are going to be underneath the epithelial layer. So you'll see where it's just an aggregation of reticular fibers and lymphoid cells. This is a place where lymphocytes can meet their match, so their specific match, and they can grow and change here. Sometimes you can see lymphoid follicles are going to form part of lymph nodes, at least some of them. But you're going to see these follicles or nodules mainly in the intestinal tract. So this is showing that here. This is your intestines, small intestine here, and then you can see a nodule down here. And also your tonsils are going to be a lymphoid follicle, so in the back of your throat as well, back of your oral cavity. So lymphoid organs as well. Again, we're going to talk significantly about lymphocytes when we get to the immune system. So there are two types of lymphocytes. There are B lymphocytes and T lymphocytes. Literally, the B and the T is B is for bone, and thymus is making the T. That's where it comes from. B lymphocytes mature in the bone marrow. Thymus is where T lymphocytes mature. Both are made by the red bone marrow, so don't get confused with that, and I'll go over that again. So red bone marrow is where they are produced, but they grow up and mature either staying in the bone. B lymphocytes just stay there. They don't leave the house. T lymphocytes go to the thymus, and that's where they grow up. So those are going to be the primary areas where they mature: bone marrow for B lymphocytes or the thymus. Once they're mature, then they can go to other areas of the body. So we'll talk about what maturation occurs when we get to the immune system. So wherever else, mature lymphocytes, they're grown up, they're ready. Wherever they find their specific antigen, their specific kind of issue, and become activated are going to be secondary areas. So everywhere else besides the bone marrow and the thymus. So we have lymph nodes, the spleen, what we call MALT or mucosa associated lymphoid tissue, and then those diffuse lymphoid tissues. So you can see these are going to be secondary. So the tonsils, lymph nodes, we'll see a bunch of them. The spleen is a major one. Appendix is going to be an area. And we have lymphoid nodules. Specifically, they can also be called Peyer's patches in the intestinal tract. So the most numerous, not the largest lymphatic organ is the spleen, but the most numerous of them is going to be lymph nodes. And like I said, there's a lot of them. We think of them just kind of specifically in the armpits or the axillary lymph nodes, under the chin, the submandibular, but there's tons of lymph nodes everywhere. So there's about 450 in an adult. So first off, they're going to be kind of a little shape, and again, kind of they come a lot of times in chains, where there'll be a chain of lymph nodes where lymph is going in one direction. So that reticular fiber, again, is branching and has lymphocytes and macrophages on it. Macrophages, again, are the non-specific pac-men of the immune system. So they phagocytic, meaning they eat. So they'll destroy microorganisms, so the tiny little disease-causing things, and also cellular debris. Say if something has broken or been destroyed and there's little pieces of the cell, so you can also think of them as the janitors. They're going to clean up the mess of the debris. So macrophages are able to take out that. And this is another important thing. So this is all in tissues. Yes, lymph from the bloodstream is going through, but if there's anything in the interstitial space, that's coming in and getting through this that wasn't originally in the blood. It was just in the tissues in the interstitial space. Well, that's going to be added to lymph as well. Remember, we had the valves where fluid that entered the interstitial space would go through. Well, if there's some sort of microbe that was here, it's going to go with the fluid into the lymph. So it was never originally in the blood, and it's never going to get in the blood, because if it's destroyed in the lymph nodes and it doesn't go back to venous circulation, it'll never get into the bloodstream, which is an important part. It's also a place where we have lymphocytes, which is going to be, they have to be activated, meaning they have to meet their match. So they find their soulmate, and then they will start attacking once they find their soulmate. Again, we'll go into more specifics when we get to the immune system. So lymph nodes, most are a little bean, and they're little, about less than an inch. They're tiny. They do have a fibrous capsule that contains them, so they are kind of little bean shaped, and have a capsule around them. So then we have the capsule that actually divides it into little section and compartments. And you're going to see a cortex and a medulla a couple more times in AP2. So the cortex is the outer part, and you can think medulla is the inner. So M is for middle here. So the cortex is going to be the outer section, everything kind of on the outer section of the lymph node. And then the medulla is going to be the inner section. So first, the cortex, again, superficial or outer area, is going to have those follicles. So just sections of reticular tissue, the loose connective reticular tissue, and B lymphocytes. So B lymphocytes, again, they're not maturing there. They're mature, grown up, ready to meet their match. In the inside, we're going to have T lymphocytes. T lymphocytes are going to be in the kind of deep middle, but usually the T lymphocytes don't hang out for long. They'll stay in there for a second, then they'll leave. So they're constantly circulating. And we'll talk about why that is in the immune system when we get to why, like what specifically a B lymphocyte does and what specifically a T lymphocyte does. Again, the medulla is going to be in the middle. So technically on the last one, sorry, it should have been the kind of inner cortex. And then the medulla, you're going to have more T lymphocytes and B lymphocytes on just kind of cords still. You also have sinuses or spaces throughout the node. So this is going to be areas with more reticular fibers, again, place for those cells to attach to, more macrophages. So not only are you going to have macrophages in the cortex, you're going to have it in the medulla, so they can eat anything that they find that's foreign or abnormal. So remember, afferent, the A part, and the E, this is going to come back and haunt you a couple more times in AP2 as well. So lymph enters the convex side, meaning the kind of bulged outside, through afferent lymphatic vessels. They're going towards the lymph node. And then they exit the efferent lymph node, which is the concave side. Usually you'll see hilum as well a couple more times. Where vessels are and there's kind of a convex or a cave or concave area or a cave, that's going to be where a hilum is. So basically a hilum is a concave area. So those are where you're exiting. So you exit the cave. One major difference is there's less exits or less efferent vessels than there are afferent vessels. So imagine if you have a room that has a one-way, because remember again, lymph vessels is going a one-way street. So imagine if you have a place that has 4 or 3 doors or even 4 doors, but you only have 1 exit. So imagine walking in a room and you can walk freely and use 3 doors, but you want to leave it and there's only 1 door to leave. So if you have a bunch of people inside, well, it's going to be easier to get in because of the 3 doors versus it's going to be a backup of getting out. You can also use my traffic analogy. If you have 3 lanes going along in traffic, and then all of a sudden you just go down to 1 lane where all these have to go over here, well, traffic's going to back up. Why do we want this in lymph nodes? So we want less exits than we have entrances. Because that slows down fluid movement, and we want to slow down fluid movement because that gives us time to sort through all that fluid and look for foreign objects. If it's just flying by and going, we're not going to notice things. If it slows down, you have time to look around, you can kind of pick through things, you can kind of take your time and really find what you need to find. If you're in a rush and you move through it really quickly, you're going to miss things. So it just makes these more effective because there's more time. And oftentimes, again, lymph will travel through several lymph nodes. A lot of times they're in chains. So you'll have the next one, and then the next one, and the next one. So you'll have a chain. So even slowing down the fluid movement, if you miss one, well, then this guy can check. And then if you miss one, this guy can check, and this guy can check. So you have kind of a backup plan if you miss something. So just looking again at a better picture. So the cortex again is the outer section here. It's pretty significant. The medulla is a lot smaller. So the medulla is kind of the middle section more here. Outer cortex is going to be here. And then again, this is going to be the major thing. So you see how many afferent vessels are coming in here. There's another one here, 2, 1. So again, it's going to back up a lot of fluid if it's all leading to this one exit if there's a bunch of entrances. So I've mentioned a couple of times again, lymph nodes like to be in chains or groups along kind of the larger lymphatic vessels. A lot of times there are some in your legs, but a lot of times there's a lot in your abdomen, armpit area, chest, all of those places. Neck as well. So cervical, axillary, inguinal, so at the base of your legs. And also again, pelvic, abdominal, thoracic. So one thing about the lymphatic tissue, one kind of abnormality that kind of heard about in history. So the bubonic plague um, was because of some of it was swollen lymph nodes, which are called buboes. So that's where it comes from. A bubo is an inflamed, sore lymph node. And that's because they're infected, because the infection comes in case of the bubonic plague, it was a bacteria. So bacteria comes in, infection comes in, and all the white blood cells are fighting really hard, and there's a huge war, and they're doing their best they can, but they are overwhelmed and trying to take care of the infection because those bacteria can multiply so quickly, so fast that the white blood cells are fighting and they're dying. So pus can happen, and pus is literally dead white blood cells. So this is all the carnage from the fighting. And if they're swollen because there's so many white blood cells, there's so much fluid there that they get kind of swollen. There's only so much they can expand because of that fibrous capsule. So it can become painful. And so that's when we again call them a bubo if it's infected. So the bubonic plague a lot of times was overwhelmed lymph nodes. Specifically, it was by a bacteria called Yersinia pestis. We do see bubonic plague rarely, but we see it in the United States, usually in the Southwest. And luckily, we know if we get an antibiotic, we can take care of the Y pestis. Another thing that happens in lymphatic system is cancer. Oftentimes we check the lymph nodes. So if you have a mass associated with somewhere, we're going to check the closest lymph nodes that are around because a lot of times cancer cells can break free from the tumor, so the original tumor. They can be in the interstitial fluid and then they can join the lymphatic vessels. So they tend to move through into lymph nodes, and that's kind of how it spreads because then the cancerous tissue can set up a spot in the lymph node, destroy the node, and then go to the next one. So that's why oftentimes we're checking the lymph nodes for cancer as well. And oftentimes we're going to see swollen lymph nodes, but the white blood cells are not fighting against them. It's just the cancer cells take over all the cells and push everything out that are in the lymph node. So it's swollen, but it's not necessarily painful because there's no inflammation associated with it like there is with infection.